Thank you, Mr. Speaker. And a few questions to the proponent of the bill.
You may proceed.
I do sit on the Human Services Committee, and we did hear extensive testimony on this, and it appears there is a great need for more understanding and more service, filling in service gaps for the LGBTQ community, plus, I've learned, plus community. To the proponent of the bill, can you tell me what some of the risk factors are that is the reason why this legislation was put forward through you?
Representative Ali Brennan.
We have received a lot of information regarding the service needs and gaps in the state, and some of that includes that 23% of Connecticut's homeless youth is LGBTQ, even though the community represents about 4% of the state's population. 22% of Connecticut's LGBTQ population reported being food insecure, and a similar share of that same population reported having annual incomes of less than $24,000. I'd add that in 2017, according to FBI data, 15% of all hate crimes victimized people that were LGBTQ. There's some other challenges we see are finding care provider in the medical field who will understand the identity and lived experience that people with the LGBT community face. Through you, Mr. Speaker.
Representative Wood.
Thank you for that answer. And is the needs assessment that will be part of this organization, part of this committee, so to speak, will be looking at filling in the service gaps and coordinating throughout the state. Is that correct, through you?
Representative Ali Brennan.
Correct. Through you, Mr. Speaker.
Representative Wood.
Again, sitting through the public testimony on this, it's clear this is an area of need in our state, and I absolutely support the spirit of this legislation and the intent of it, and I believe it's a vulnerable population that we need to open our hearts to and figure out how we can close the gaps on some of these needs and embrace them as with great humanity. So I stand in support and thank the proponent for bringing out this bill, and thank you, Mr. Speaker.